The fluorescent lights buzzed overhead as Marcus Thompson collapsed in the crowded emergency room waiting area of St. Mary's General Hospital. His weathered hands clutched his chest, sweat beading on his forehead as he gasped for air. The triage nurse barely glanced up from her computer screen, dismissing him as just another homeless man seeking attention. What she didn't see was the faded combat medic tattoo hidden beneath his torn jacket sleeve, a symbol that would soon change everything when Dr. Rachel Martinez walked through those doors. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed because tomorrow, I've saved something extra special for you. The automatic doors of St. Mary's General Hospital emergency room whooshed open as Marcus Thompson stumbled inside, his legs barely carrying his 62-year-old frame. The harsh fluorescent lighting made his pale complexion appear almost ghostly, and his unkempt grey beard couldn't hide the pain etched across his weathered face. His clothes, a faded army surplus jacket with holes in the elbows and jeans that had seen better decades, marked him immediately in the eyes of the busy staff. Behind the reception desk sat Nurse Patricia Williams, her perfectly manicured nails clicking against the keyboard as she processed paperwork. She'd been working the night shift for 8 years, and she'd developed what she called street radar, the ability to spot troublemakers, drug seekers, and time wasters from across the room. When Marcus approached her desk, stumbling slightly and breathing heavily, every alarm in her head went off. "Excuse me," Marcus wheezed, his voice barely above a whisper. I think I'm having a heart attack." Patricia didn't look up from her screen. "Take a number and have a seat. We'll get to you when we can." Her tone carried the practiced indifference of someone who'd heard every sob story imaginable. Marcus fumbled with the ticket dispenser, his hands shaking as he pulled number 47. The digital display showed they were currently serving number 23. He shuffled toward the crowded waiting area, past families with crying children, elderly patients with worried relatives, and young adults nursing various injuries from the Friday night chaos. The plastic chair groaned under his weight as he sat down, clutching his chest. The pain felt like someone was driving a railroad spike through his sternum, radiating down his left arm in waves that made his fingers tingle and go numb. His breathing became more labored with each passing minute, but the noise of the busy ER masked his distress. 20 minutes passed, then 30. Marcus watched as number after number was called, but somehow his seemed to be skipped over. A well-dressed businessman with a minor cut on his hand got immediate attention. A college student complaining of stomach pain was seen within 15 minutes. But Marcus remained in his chair, growing paler by the moment. "Number 31, called a voice from the triage station. Marcus looked at his ticket again. 47. He tried to catch Patricia's eye, but she was deliberately avoiding his gaze, focused intently on her computer screen whenever he looked in her direction. In her mind, she was protecting valuable resources from someone who was probably just looking for a warm place to sleep or trying to score prescription medication. The pain in Marcus's chest intensified, spreading now to his jaw and down both arms. Cold sweat dampened his shirt beneath the worn jacket. His vision began to blur slightly around the edges, but he fought to stay conscious. He'd survived worse than this, much worse, in the mountains of Afghanistan 15 years ago, when roadside bombs and insurgent attacks were daily realities. As a combat medic with the 82nd Airborne Division, Marcus had saved dozens of lives under impossible conditions. He'd performed battlefield surgery in foxholes while mortar rounds exploded overhead. He'd carried wounded soldiers through minefields to reach evacuation zones. The tattoo on his right forearm, partially hidden by his jacket sleeve, bore witness to those days. A red cross surrounded by wings with "Combat Medic" written in bold letters underneath, but those days felt like a lifetime ago. After 3 tours of duty, Marcus had returned home to a world that didn't understand what he'd seen or done. The nightmares started first, then the drinking, then the gradual alienation from friends and family who couldn't relate to his experiences. His marriage to Sarah had crumbled within 2 years of his return. His job at the auto repair shop lasted only 18 months before his increasing absences and erratic behavior led to his dismissal. The downward spiral had been swift and merciless. Without steady income, Marcus lost his apartment. Without an address, finding new work became nearly impossible. The VA hospital was overbooked and understaffed, with waiting lists stretching months for mental health services. Pride prevented him from reaching out to his military buddies, who seemed to be doing fine with their transitions back to civilian life. For the past 3 years, Marcus had been living in his beat-up 1998 Ford Explorer, parked in different locations around the city to avoid attracting attention from police. He survived on odd jobs, occasional handouts, and his military pension, barely enough to keep gas in the tank and food in his stomach. He'd learned to make himself invisible, to avoid drawing the kind of attention that might get him arrested or moved along by authorities. Tonight had started like any other. Marcus was parked behind a 24-hour diner, trying to get some sleep in the back of his SUV when the chest pain began. At first, he dismissed it as heartburn from the expired sandwich he'd found in the diner's dumpster. But as the pain intensified and spread, he knew this was something more serious. The drive to St. Mary's had been harrowing. Marcus had to pull over twice, as waves of nausea and dizziness nearly caused him to lose control of the vehicle. He'd chosen this hospital because it was the closest, not because he had any insurance or means to pay for treatment. In his condition, those concerns seemed secondary to staying alive. Now, sitting in the waiting room as his condition deteriorated, Marcus began to wonder if he'd made a mistake coming here at all. The dismissive treatment from the staff was nothing new. He'd experienced similar reactions at grocery stores, employment offices, and social service agencies. His appearance automatically categorized him as undesirable, someone to be processed quickly and forgotten. Number 38, came another announcement. Marcus closed his eyes and tried to focus on his breathing, a technique he'd learned during his military training. In through the nose, hold for 4 counts, out through the mouth. But each breath was becoming more difficult, more shallow. The pain in his chest felt like a vice tightening with every heartbeat. A young mother sitting nearby noticed his distress and approached hesitantly. "Sir, are you okay? You don't look well." Marcus tried to smile reassuringly, but it came out as more of a grimace. "I'll be fine, ma'am. Thank you for asking." The woman looked toward the reception desk, then back at Marcus. "Maybe I should tell someone." "Please don't," Marcus interrupted softly. "I don't want to cause any trouble." The woman hesitated for a moment longer, then returned to her seat with her child, casting worried glances in Marcus's direction. Her concern touched him more than she could know. It had been months since anyone had shown him basic human kindness. The wall clock showed 11:47 p.m. Marcus had been waiting for nearly an hour, and his number still hadn't been called. The waiting room had thinned out somewhat, as the evening's casualties were processed. But new patients continued to arrive, victims of bar fights, domestic disputes, and late-night accidents. Patricia Williams remained at her post, efficiently checking in new arrivals, while continuing to ignore Marcus's deteriorating condition. In her experience, the homeless population often dramatized their symptoms to receive faster treatment or gain access to controlled substances. She'd seen too many fake seizures, exaggerated injuries, and manufactured emergencies to waste sympathy on every disheveled person who wandered through the doors. What Patricia didn't realize was that Marcus Thompson was dying. The heart attack that had begun as chest pain was progressing rapidly, cutting off blood flow to vital cardiac muscle. Every minute of delay was literally killing him, destroying tissue that could never be replaced. Marcus slumped further in his chair, his breathing becoming increasingly shallow and rapid. The fluorescent lights seemed to pulse in rhythm with his failing heartbeat, and the voices around him began to sound distant and muffled, as if coming from underwater. It was at that exact moment, 11:52 p.m. on a Friday night in October, that Dr. Rachel Martinez pushed through the emergency room doors. Returning from her dinner break, Dr. Rachel Martinez paused just inside the emergency room entrance, her trained eyes automatically scanning the waiting area as she always did after breaks. 23 years of emergency medicine had taught her to read a room within seconds, identifying the most critical cases, the drug seekers, the worried families, and the patients who might be sicker than they appeared. Her gaze stopped on Marcus Thompson. Something about the way he was sitting triggered her medical instincts. His posture was wrong, too rigid, too controlled, like someone fighting to remain conscious. His skin had a grayish pallor that stood out even under the harsh waiting room lighting, and there was a subtle but unmistakable pattern to his breathing that she recognized immediately. Rachel had seen this exact presentation countless times during her residency at Chicago General, then later during her deployment with the Army Medical Corps in Iraq. Acute myocardial infarction, a heart attack in progress. The man was dying, and somehow he'd been sitting in her waiting room long enough for his condition to reach critical stages. She strode quickly to the reception desk, her white coat fluttering behind her. "Patricia, how long has that gentleman been waiting?" Patricia glanced up from her computer screen with practiced indifference. "Which one?" "The homeless guy. He came in about an hour ago claiming chest pain. Typical attention-seeking behavior. You know how they are." Rachel's jaw tightened. "Did anyone perform a triage assessment?" "I gave him a number. He's 47 in line. What number are we serving now?" Patricia checked her screen. 39. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. Rachel's training kicked into overdrive. An hour wait with active chest pain symptoms in a patient showing obvious signs of cardiovascular distress was a potentially fatal delay. She grabbed a wheelchair from the nearby station and moved quickly across the waiting room. Marcus was barely conscious when Rachel knelt beside his chair. His eyes were half closed, his breathing shallow and rapid. A thin sheen of perspiration covered his face, despite the cool temperature of the waiting room. "Sir, can you hear me?" Rachel's voice was calm but urgent. "I'm Dr. Martinez. I need you to stay with me." Marcus's eyes fluttered open, struggling to focus on her face. I think something's wrong," he whispered. "I know. We're going to take care of you right now." Rachel quickly assessed his pulse, weak, irregular, and far too rapid. His skin was cool and clammy to the touch. Classic signs of cardiogenic shock. "Can you tell me when the pain started?" "Maybe 2 hours ago," Marcus managed between labored breaths. 2 hours. Rachel's mind raced through protocols and treatment options. If this was indeed a major heart attack, the window for optimal intervention was rapidly closing. Every minute of delay increased the likelihood of permanent cardiac damage or death. She helped Marcus into the wheelchair, noting how his weight seemed to be mostly supported by the chair's frame. "We're going straight to Trauma Bay 3, she called to the nearest nurse. "I need a 12-lead EKG, IV access, oxygen, and cardiac enzyme stat." As they moved through the corridors toward the treatment area, Rachel continued her assessment. Marcus's jacket had fallen open slightly, revealing a glimpse of something on his right forearm. She caught just a flash of red and black ink, but her focus remained on keeping him stable and conscious. The trauma bay erupted into controlled chaos as Rachel's team sprang into action. Nurse Jennifer Collins, a 15-year veteran of emergency medicine, began attaching cardiac monitors while respiratory therapist Michael Chen prepared oxygen delivery. Lab technician David Park readied blood draw equipment for the cardiac enzyme tests that would confirm the suspected diagnosis. "Talk to me about the pain," Rachel said as she examined Marcus more thoroughly. "Scale of 1 to 10? 8. Maybe 9, Marcus gasped. "Goes down my arm." "Into my jaw." The cardiac monitor began displaying Marcus's heart rhythm, and Rachel's worst fears were confirmed. The EKG showed clear evidence of an ST elevation myocardial infarction, a major heart attack affecting the anterior wall of his heart. This was the kind of cardiac emergency that required immediate intervention to prevent death or permanent disability. "Get cardiology on the line," Rachel ordered, "and prep for possible cath lab transfer. This is a STEMI." As the team worked around Marcus, Rachel began cutting away his jacket to better examine him and establish additional IV access. It was then that she saw the tattoo clearly for the first time. The image stopped her cold. On Marcus's right forearm was a detailed military medical tattoo, a red cross with wings, surrounded by the words Combat Medic and 82nd Airborne Division. Below that was a ribbon with dates, 2007-2012, and Operation Enduring Freedom. Rachel stared at the tattoo for a long moment, memories flooding back. She had served her own deployment with the 47th Combat Support Hospital in Iraq from 2008 to 2009. She knew exactly what that tattoo meant, exactly what this man had done, exactly what he had sacrificed. Combat medics were the unsung heroes of military operations. They were the soldiers who ran toward gunfire when others took cover, who risked their lives to save wounded comrades under impossible conditions. They were trained to perform emergency surgery in foxholes, to make life and death triage decisions in seconds, and to carry wounded soldiers to safety while under enemy fire. The 82nd Airborne Division was particularly legendary, an elite paratrooper unit that had seen some of the heaviest combat in Afghanistan. During Marcus's years of service, Rachel knew that anyone wearing that particular combination of insignia had earned it through blood, sweat, and unimaginable courage. "Doctor?" Nurse Collins's voice brought Rachel back to the present moment. "His pressure is dropping. 90/50. Rachel refocused on the medical crisis at hand, but something fundamental had shifted in her approach to this patient. This wasn't just another emergency room case. This was a fellow veteran, a brother-in-arms who had dedicated years of his life to saving others in combat zones. "Increase the IV fluids and get me 2 units of O-negative standing by," she ordered. "And I want that cardiologist here in 5 minutes, not 10. Marcus's condition was deteriorating rapidly. The heart attack had progressed to the point where his cardiac output was insufficient to maintain adequate blood pressure. Without immediate intervention, he would go into complete cardiovascular collapse within minutes." Rachel leaned close to Marcus's ear. "I need you to stay with me," she said firmly. "You've been through worse than this. You've saved lives under enemy fire. Now let us save yours." Marcus's eyes widened slightly. Through his pain and confusion, he seemed to recognize something in Rachel's voice, some understanding that went beyond the typical doctor-patient interaction. "How did you—" he began, then noticed her looking at his tattoo. "I served too," Rachel said simply. "Different unit, different time, but I know what that means." She gestured toward his combat medic insignia. "How many lives did you save over there?" Despite his critical condition, Marcus managed a weak smile. "Lost count after 50, he whispered. Rachel felt a surge of anger at how this man had been treated in her emergency room. Here was someone who had dedicated years of his life to saving others, who had risked everything for his country and his fellow soldiers, and he had been dismissed and ignored because of his appearance. The trauma bay doors burst open as Dr. James Harrison, the on-call cardiologist, arrived with his team. Rachel quickly briefed him on Marcus's condition and the urgent need for cardiac catheterization to restore blood flow to his damaged heart. "How long has he been symptomatic?" Dr. Harrison asked as he reviewed the EKG results. "Approximately 2 hours total. But he's been in our waiting room for over an hour without treatment," Rachel replied. Unable to keep the frustration out of her voice, Dr. Harrison's expression darkened. "An hour with this presentation?" "There was a miscommunication at triage," Rachel said diplomatically, though internally she was furious at the delay that had nearly cost Marcus his life. As the cardiology team prepared to transfer Marcus to the catheterization lab for emergency intervention, Rachel squeezed his hand. "You're going to make it through this," she told him. "That's an order, soldier." Marcus looked up at her with eyes that suddenly seemed clearer, more focused. "Thank you, ma'am," he said in a voice that carried echoes of the disciplined young soldier he had once been. The transfer to the cardiac catheterization lab was swift and efficient. Rachel watched as Marcus disappeared through the doors, surrounded by the cardiology team that would attempt to save his life. She stood in the hallway for a long moment, thinking about the cruel irony of the situation. This man had once been responsible for saving lives in combat zones, making split-second decisions that meant the difference between life and death for wounded soldiers. Now he had nearly died in a hospital waiting room because someone had judged him unworthy of timely medical care based solely on his appearance. Rachel walked slowly back toward the emergency room, her mind already forming the conversation she would need to have with Patricia Williams about proper triage protocols and the importance of treating every patient with dignity and respect, regardless of their circumstances. But first, she had other patients to see, other lives to save. The emergency room never stopped, never slowed down, never gave anyone time to fully process the human dramas that played out within its walls. Every single day, the cardiac catheterization lab at St. Mary's General Hospital hummed with quiet efficiency as Dr. James Harrison and his team worked to save Marcus Thompson's life. Through a small incision in his wrist, they threaded a thin catheter through his arteries toward his heart, guided by real-time X-ray imaging that displayed his coronary anatomy in stark black and white. Rachel Martinez stood in the observation area, watching the procedure through the lead-glass window. She had changed into fresh scrubs and grabbed a cup of coffee, but her attention remained fixed on the monitors showing Marcus's vital signs. His blood pressure had stabilized somewhat, but his heart rhythm remained dangerously irregular. "There's the culprit," Dr. Harrison announced, pointing to the screen where a complete blockage was, visible in Marcus's left anterior descending artery. The vessel cardiologists grimly referred to as the widow maker. The clot had cut off blood supply to a large portion of his heart muscle, causing the tissue to begin dying from lack of oxygen. Rachel watched as the cardiology team deployed a tiny balloon to compress the clot against the arterial wall, then positioned a stent, a small mesh tube, to keep the vessel open permanently. The procedure was delicate and precise, requiring years of specialized training to perform successfully. While Marcus underwent his life-saving treatment, Rachel found herself thinking about her own military service and the parallels between battlefield medicine and emergency room care. Both environments demanded split-second decision-making, the ability to function under extreme pressure, and an unwavering commitment to preserving life regardless of the circumstances. Her deployment to Iraq had been formative in ways she was still discovering years later. She had arrived as a young emergency medicine resident, eager to serve her country but unprepared for the realities of treating combat casualties. The first time she had worked on a wounded soldier, a 19-year-old Marine with shrapnel wounds from an improvised explosive device, she had nearly frozen with the enormity of the responsibility. It was an experienced combat medic, not unlike Marcus, who had talked her through that first critical case. "Doc, this kid's counting on us," the medic had said calmly while applying pressure to a severed artery. "We can save him, but we need to work together and we need to work fast." That medic's steady presence and expertise had been the difference between life and death for the wounded Marine. Over the following months, Rachel had learned to rely on the combat medics attached to her unit. They were the bridge between the chaos of the battlefield and the controlled environment of the field hospital, bringing wounded soldiers to safety while providing crucial initial treatment that often determined survival outcomes. The beeping of her pager pulled Rachel from her memories. Another emergency was coming into the trauma bay, a motorcycle accident with multiple injuries. She took one last look at Marcus's procedure, whispered a silent prayer for his recovery, and hurried back to the emergency room. The next several hours passed in a blur of medical emergencies. Rachel treated a construction worker who had fallen from scaffolding, a teenager suffering from an allergic reaction, and an elderly woman experiencing complications from diabetes. Each case demanded her complete attention and expertise, but part of her mind remained focused on Marcus and his progress in the cardiac unit. It wasn't until nearly 4 a.m. that she had a chance to check on him. The cardiac intensive care unit was quieter than the emergency room, with dimmed lighting and the soft whoosh of ventilators providing a counterpoint to the various monitoring devices. Marcus was awake, though clearly exhausted from his ordeal. "How are you feeling?" Rachel asked, pulling up a chair beside his bed. Marcus turned his head toward her, managing a weak smile. "Like I got hit by a truck, ma'am. But I'm alive thanks to you. Dr. Harrison and his team did the hard work," Rachel replied. "I just made sure you got the care you deserved from the beginning." Marcus was quiet for a moment, studying her face in the dim light. "You said you served where?" 47th Combat Support Hospital, Iraq, 2008 to 2009, Rachel answered. "Different war, different desert, but probably similar experiences." "CSH units saved a lot of lives," Marcus said thoughtfully. "And we always felt better knowing you folks were there backing us up when things went sideways." Rachel nodded, remembering the endless stream of helicopters bringing wounded soldiers to their facility. "What was your specialty as a combat medic?" "I started as a regular line medic with an infantry company," Marcus explained, his voice growing stronger as he talked about his service. "But I had some natural aptitude for trauma care, so they sent me to additional training. Ended up being the primary medic for a special forces unit during my last 2 deployments." Rachel's respect for Marcus deepened further. Special forces medics underwent some of the most intensive medical training in the military, learning to perform procedures that would challenge civilian paramedics and even some physicians. They were expected to function as emergency room doctors. Surgeons and field medics all rolled into one, often operating in remote locations with minimal equipment and no backup. "That's impressive training," she said. "What kind of cases did you handle?" Marcus's expression grew distant, and Rachel could see memories playing behind his eyes. "Everything you can imagine and some things you hope you never have to see again. Gunshot wounds, blast injuries, burns, compound fractures. Had to perform an emergency cricothyrotomy on a sergeant who took shrapnel to the throat during a firefight. Did it with a ballpoint pen and a pocket knife while rockets were exploding 50 meters away." Rachel understood the weight of those memories. She had seen similar cases during her deployment, but always in the relatively controlled environment of a field hospital. Marcus had been performing life-saving procedures literally under fire, with lives hanging in the balance and no room for error. "How many soldiers did you treat?" she asked gently. "Lost count after a couple hundred," Marcus admitted. "But I remember everyone I couldn't save. Their faces, their names, what happened to them. Sometimes I wake up at night still hearing them calling for their mothers or their wives." The conversation was interrupted by the arrival of Dr. Harrison, who was making his morning rounds. He reviewed Marcus's charts and checked his surgical site, expressing satisfaction with his progress. "The stent placement was successful," Dr. Harrison explained. "We restored blood flow to the affected area, though there was some cardiac muscle damage from the delay in treatment. With proper medication and lifestyle changes, you should make a good recovery." After Dr. Harrison left, Rachel remained with Marcus for a few more minutes. She could see questions in his eyes, questions about his future, his housing situation, his ability to pay for the expensive medical treatment he had received. "There's something I need to tell you," Rachel said, choosing her words carefully. "The delay in your treatment tonight was unacceptable. You should have been seen immediately upon arrival, and the fact that you weren't nearly cost you your life." Marcus shifted uncomfortably in his bed. "I'm used to being overlooked, Doc. Comes with the territory when you look like I do." "That's exactly the problem," Rachel replied firmly. "Your appearance, your housing situation, your ability to pay, none of that should affect the quality of medical care you receive. You served your country with honor, you saved countless lives, and you deserve better treatment than what you got tonight." She paused, considering her next words carefully. "I'm going to make sure this doesn't happen again, not just to you, but to anyone who comes through our doors. And I'm going to help you get connected with resources that can assist with your housing and healthcare needs." Marcus's eyes filled with tears, the first real emotion he had shown since arriving at the hospital. "I don't know what to say, ma'am. It's been a long time since anyone treated me like I mattered." "You do matter," Rachel said firmly. "What you did in Afghanistan matters. The lives you saved matter. And your life matters just as much as anyone else who walks through our doors." As the morning shift began to arrive, Rachel prepared to end her overnight rotation. But her work with Marcus Thompson was far from over. She had already begun formulating plans to connect him with veteran services, housing assistance programs, and ongoing medical care. More importantly, she was determined to address the systemic issues that had allowed a decorated veteran to be ignored and dismissed based solely on his appearance. The conversation she needed to have with Patricia Williams would be just the beginning of broader changes, to ensure that every patient received dignified, timely care regardless of their circumstances. The sun was beginning to rise over the city as Rachel finally headed home. But she knew that Marcus's story was just beginning a new chapter, one that would hopefully restore not just his health, but his sense of dignity and place in the world he had once served with such distinction. 3 days after his heart attack, Marcus Thompson sat in a wheelchair at the hospital's discharge planning office, still struggling to believe the transformation his life had undergone. The crisp white button-down shirt and khaki pants he wore were donations from the hospital's emergency clothing fund, but they made him feel human again in a way he hadn't experienced in years. Across from him sat Amanda Foster, a social worker specializing in veteran services, her laptop open as she navigated through various assistance programs. Dr. Rachel Martinez had personally called Amanda that morning, explaining Marcus's situation and requesting immediate intervention to prevent him from returning to homelessness upon discharge. "Your military service record is impressive," Amanda said, reviewing the documents that had been expedited from the Department of Veterans Affairs. 3 tours in Afghanistan, Purple Heart, Bronze Star with V Device for Valor, and an Army Commendation Medal for your work as a Special Forces medic. You've got significant benefits available that you haven't been accessing." Marcus shook his head slowly. "I tried going to the VA when I first got back. The waiting lists were months long, and I couldn't afford to miss work for appointments. Then when I lost my job and my apartment, it seemed pointless." Amanda's expression softened with understanding. She had worked with hundreds of veterans over the years and knew how easy it was for even decorated soldiers to fall through the cracks of an overburdened system. The landscape has changed significantly in the past few years. New programs, streamlined processes, and priority scheduling for veterans with service-connected disabilities. She pulled up a housing assistance program on her screen. "Based on your medical records and service history, you qualify for immediate placement in transitional housing through the HUD-VASH program. It's not permanent, but it gives us 6 months to get you stabilized and into long-term housing." Marcus felt a flicker of hope that he quickly tried to suppress. He had been disappointed too many times before to get his expectations up. "What's the catch?" "No catch," Amanda replied firmly. "You earned these benefits through your service. The apartment is furnished, utilities included, and there's on-site support staff to help with job placement and healthcare coordination." While Amanda continued explaining the available programs, Marcus found his thoughts drifting to the conversation he'd had with Dr. Martinez the previous evening. She had stopped by his room after her shift to check on his progress and share some difficult news about the investigation into his initial treatment. The hospital's review of security footage and staff interviews had revealed the extent of Patricia Williams's negligence. Marcus had been clearly visible in distress for over an hour, and multiple patients had approached the reception desk, asking if someone should check on him. Patricia had dismissed each inquiry, maintaining her assumption that he was faking symptoms for attention or drugs. Dr. Martinez had been direct about the consequences. Patricia has been suspended pending a full investigation. Her actions violated every protocol we have for patient triage and care. You could have died because of her prejudice and negligence. Marcus had felt conflicted about the news. While he was angry about his treatment, he also understood the pressures hospital staff faced and didn't want to destroy someone's career. But Dr. Martinez had been adamant that accountability was essential to prevent similar incidents in the future. Your case has already led to mandatory retraining for all triage staff, she had explained. We're implementing new protocols that require immediate assessment for anyone presenting with chest pain, regardless of their appearance or perceived social status. Now, sitting in the discharge planning office, Marcus realized that his experience might actually help other people receive better care in the future. The thought gave his suffering some meaning beyond his own recovery. Amanda's voice brought him back to the present moment. I've also arranged for you to meet with Dr. Sarah Chen at the VA Medical Center. She specializes in cardiac rehabilitation for veterans and can coordinate your follow-up care. Your appointment is scheduled for tomorrow afternoon. The efficiency with which his life was being reorganized was almost overwhelming. After years of bureaucratic dead ends and closed doors, suddenly every barrier was being removed. Marcus suspected Dr. Martinez's influence was opening doors that had previously been locked tight. There's one more thing, Amanda continued, pulling out a different folder. Dr. Martinez mentioned that you had significant experience as a combat medic. Have you ever considered returning to healthcare work? Marcus looked up in surprise. I thought about it when I first got back, but civilian medical credentials are different from military training. Plus, with my record, the drinking, the arrests for vagrancy, I figured no one would hire me. Actually, there's a pilot program specifically designed for veterans with medical training who want to transition into civilian healthcare careers, Amanda explained. It's a partnership between the VA and local hospitals that provides credentialing assistance, addiction counseling if needed, and job placement support. She handed him a brochure featuring smiling veterans in medical scrubs. The program director is Dr. Kevin Walsh, a former Navy corpsman who went through similar struggles after his service. He specifically looks for veterans who understand both the medical field and the challenges of readjusting to civilian life. Marcus studied the brochure, hardly daring to hope that he might someday work in medicine again. His military training had been extensive. He could start IVs, interpret basic EKGs, perform minor surgical procedures, and manage trauma cases that would challenge many civilian paramedics. But he had convinced himself that those skills were worthless in the civilian world. Would they really consider someone with my background? He asked quietly. Dr. Walsh's philosophy is that past mistakes don't define future potential, Amanda replied. He's more interested in your clinical skills, your commitment to helping others, and your willingness to work hard. Your military medical experience actually makes you a very attractive candidate. The conversation was interrupted by a knock on the office door. Dr. Martinez entered, wearing street clothes and carrying a small duffel bag. I hope I'm not interrupting, she said. But I wanted to check on the discharge planning and bring you something. She set the duffel bag on the desk. This belonged to my brother Michael. He was a Marine sergeant who was killed by an IED in Helmand Province in 2011. He was about your size, and I thought you might be able to use some of his civilian clothes until you get back on your feet. Marcus felt his throat tighten with emotion. The gesture was deeply personal. Military families understood the sacred nature of a fallen service member's belongings. For Dr. Martinez to offer them to him was an honor he wasn't sure he deserved. I can't accept this, he said softly. Those should stay with your family. Michael would have wanted them to help a fellow veteran, Rachel replied firmly. He always said that service members needed to take care of each other, especially after coming home. This is what he would have wanted. Amanda watched the exchange with professional interest. She had seen how powerful these connections between veterans could be, how a simple gesture of understanding and respect could begin. Healing wounds that had festered for years. Dr. Martinez has also agreed to serve as a reference for your healthcare training program application, Amanda added. Her endorsement carries significant weight in the medical community. Marcus looked between the two women who had transformed his life in the span of 3 days. Just last week, he had been sleeping in his car, invisible to the world and convinced that his best days were behind him. Now he had housing, healthcare, and the possibility of returning to meaningful work. "I don't know how to thank you both," he said, his voice thick with emotion. "Don't thank us yet," Rachel replied with a smile. "Thank us when you're back on your feet and helping other people. That's when we'll know we made a difference." As the discharge planning session concluded, Marcus signed various forms and received folders full of information about his new benefits and services. The apartment key in his pocket felt heavier than it should have, not from weight, but from the responsibility it represented. For the first time in years, Marcus Thompson had a real chance at rebuilding his life. The road ahead would be challenging, requiring him to confront his demons and work hard to regain skills and confidence he had lost. But he wouldn't be walking that road alone. The network of support that Dr. Martinez had mobilized would be there to catch him if he stumbled, to encourage him when he doubted himself, and to remind him that his service and his life had value worth fighting for. As he prepared to leave St. Mary's General Hospital, Marcus realized that his heart attack had been both the worst and best thing to happen to him in years. It had nearly killed him, but it had also brought him back to life in ways that went far beyond physical healing. 6 months later, Marcus Thompson stood in the hallway outside the emergency room at St. Mary's General Hospital, adjusting the navy blue uniform shirt that bore his new name tag, Marcus Thompson, Emergency Medical Technician. The familiar antiseptic smell and constant hum of activity brought back memories of that terrifying night when he had nearly died in these same corridors, dismissed and forgotten. Today marked his first day as a full-time employee of the hospital's Emergency Medical Services Department. The journey from homeless veteran to certified EMT had been grueling but transformative, requiring him to confront not just his medical knowledge gaps, but also the emotional and psychological barriers that had kept him isolated for years. The transitional housing apartment that Amanda Foster had secured for him had been a lifeline during those crucial first weeks. Located in a converted office building downtown, it provided not just shelter, but also access to counseling services, job training programs, and a community of other veterans working to rebuild their lives. Marcus's first major breakthrough had come during his meeting with Dr. Kevin Walsh at the Veteran Healthcare Transition Program. Dr. Walsh, himself a former Navy corpsman who had struggled with addiction and homelessness after his service, had immediately recognized the depth of Marcus's medical knowledge and his potential for success in civilian healthcare. "Your combat medic training is actually more comprehensive than most civilian EMT programs," Dr. Walsh had explained during their initial interview. "You've performed procedures under conditions that would challenge experienced emergency room physicians. We just need to update your certifications and help you adapt to civilian protocols." The credentialing process had taken 3 months of intensive study and practical training. Marcus had to relearn civilian medication names, familiarize himself with different equipment standards, and adapt to working within hospital hierarchies rather than military command structures. Most challenging of all, he had to learn to trust himself again, after years of believing he had nothing valuable to offer. Psychological rehabilitation has been just as important as medical training. Weekly sessions with Dr. Patricia Valdez, a therapist specializing in veteran transition issues, had helped Marcus process his combat experiences and understand how they had contributed to his downward spiral after returning home. Survivor guilt is common among combat medics. Dr. Valdez had explained during one particularly difficult session. You saved so many lives that losing even one feels like a personal failure, even when you know logically that you did everything possible. Through therapy, Marcus had begun to understand that his self-destructive behavior after leaving the military wasn't a sign of weakness, but rather an understandable response to traumas he had never properly processed. The drinking, the isolation, the inability to maintain relationships, all of it had been his mind's attempt to cope with experiences that few civilians could understand. Dr. Rachel Martinez had remained involved throughout his recovery, serving not just as a medical reference, but as a mentor and advocate. She had attended his EMT graduation ceremony, introduced him to key staff members at the hospital, and helped him navigate the complex bureaucracy of healthcare employment. "I've seen a lot of second chances in this business," she had told him the night before his first day of work. "But I've rarely seen someone work as hard as you have to earn one. You're going to make a real difference here." Now, as Marcus prepared to begin his shift, he reflected on how dramatically his life had changed. The apartment he rented through the HUD-VASH program wasn't luxurious, but it was clean, safe, and entirely his own. The regular paycheck from his new job would allow him to eventually transition to independent housing and begin building financial stability. More importantly, he had regained his sense of purpose. The work of an emergency medical technician wasn't identical to his role as a combat medic, but it served the same fundamental mission, saving lives and helping people during their most vulnerable moments. His first call came less than an hour into his shift. A 34-year-old construction worker had fallen from scaffolding at a downtown building site, suffering multiple injuries, including a suspected spinal fracture. Marcus's partner, Elena Rodriguez, was a 10-year veteran of emergency medical services who had specifically requested to work with him after reviewing his military medical background. Construction sites are tricky, Elena explained as they navigated through afternoon traffic, sirens wailing, limited access, potential for additional hazards, and usually multiple injured workers who got hurt trying to help the first victim. The scene was controlled chaos when they arrived. The construction crew had done an admirable job of stabilizing the injured worker and clearing a path for emergency responders. But Marcus could see the anxiety and fear in their faces as they watched their colleague lying motionless on the ground. Marcus's combat training kicked in immediately. He rapidly assessed the scene for safety hazards, identified the primary patient and any potential secondary casualties, and began his medical evaluation. The injured worker, Carlos Mendez, was conscious but complaining of severe back pain and numbness in his legs. "Carlos, I'm Marcus, and this is Elena. We're here to take care of you," Marcus said calmly as he began his examination. "Can you tell me what happened?" "I was moving some rebar when the scaffolding shifted," Carlos replied through gritted teeth. "Fell about 12 feet onto my back. Can't feel my legs very well." Marcus carefully palpated Carlos's spine while Elena prepared the immobilization equipment. His military experience had taught him to work efficiently while maintaining constant communication with the patient, explaining each step to reduce anxiety and maintain trust. "We're going to put you on a special board to protect your spine during transport," Marcus explained as they carefully log-rolled Carlos onto the backboard. "It's going to be uncomfortable, but it's the safest way to get you to the hospital." The transport to St. Mary's General took 18 minutes, during which Marcus continuously monitored Carlos's vital signs and neurological function. He started an IV line, administered pain medication, and maintained detailed documentation of the patient's condition for the receiving medical team. As they wheeled Carlos into the emergency room, Marcus felt a profound sense of satisfaction. This was exactly what he was meant to be doing, using his skills and experience to help people during medical emergencies, making split-second decisions that could affect the rest of their lives. Dr. Martinez was on duty that evening and nodded approvingly as Marcus gave his report to the trauma team. The handoff was smooth and professional, demonstrating his mastery of civilian medical protocols while drawing on the communication skills he had honed during military service. "Nice work," Dr. Martinez told him quietly as the trauma team took over Carlos's care. "Clear assessment, appropriate interventions, and excellent patient rapport. You're a natural at this." The validation from someone whose opinion he respected deeply meant everything to Marcus. 6 months earlier, he had been a broken man sleeping in his car, convinced that his best days were behind him. Now he was back doing what he loved, using his skills to save lives and make a meaningful contribution to his community. The remainder of his shift included 2 more calls: an elderly woman experiencing chest pain and a teenager who had overdosed on prescription medications. Each case presented different challenges and required different skills, but Marcus approached them all with the calm professionalism that had made him successful as a combat medic. During his dinner break, Marcus found himself back in the hospital cafeteria where Dr. Martinez often ate during her shifts. She joined him at his table, setting down her tray with a tired sigh. "Long day?" Marcus asked. "3 cardiac arrests, 2 strokes, and a multi-vehicle accident," she replied. "Just another Tuesday in the emergency room. How was your first day?" Marcus described his calls in detail, seeking her feedback on his decisions and techniques. These informal debriefing sessions had become routine during his training, helping him bridge the gap between military and civilian medical practice. "You're adapting well," Dr. Martinez observed. "Your military background shows in the best possible ways. You're calm under pressure. You communicate clearly with patients and families, and you make decisions quickly without second-guessing yourself." Their conversation was interrupted by a commotion near the emergency room entrance. A middle-aged man in work clothes was supporting a younger woman who appeared to be in severe distress. The triage nurse, a new hire named Jennifer Kim, who had replaced Patricia Williams, immediately assessed the situation and called for assistance. Marcus and Dr. Martinez both responded instinctively, rushing to help. The woman, approximately 25 years old, was barely conscious and showing signs of severe dehydration and possible heat exhaustion. The man supporting her was her supervisor from a landscaping company, where she had been working in the afternoon heat. "She collapsed about 20 minutes ago," the supervisor explained frantically. "She said she felt dizzy and then just went down. We tried to cool her off with water, but she keeps getting worse." Dr. Martinez quickly took charge of the medical response while Marcus assisted with patient assessment and equipment. Working together, they established IV access, began fluid replacement, and initiated cooling measures to bring down the woman's dangerously elevated body temperature. As they worked, Marcus noticed something that made him pause. The woman had a small tattoo on her wrist, a military medical symbol indicating she was a veteran. He mentioned this to Dr. Martinez, who immediately adjusted their treatment approach to account for potential service-connected medical conditions. "Maria, can you hear me?" Dr. Martinez asked as the patient began to regain consciousness. "We're going to take good care of you. I noticed your medical corps tattoo. What branch did you serve in?" "Army, medic." "Like him," Maria whispered, pointing weakly at Marcus. "Got out last year, having trouble adjusting." The parallel to Marcus's own story was impossible to ignore. Here was another veteran struggling with the transition to civilian life, working a demanding manual labor job that had nearly killed her due to heat-related illness. Dr. Martinez and Marcus exchanged a meaningful look, both understanding the broader implications of the situation. After Maria was stabilized and admitted for observation, Dr. Martinez pulled Marcus aside. "I want you to talk to her when she's feeling better. Share your story about the resources available and how you turned things around. Sometimes hearing from someone who's been through similar struggles is more powerful than any medical treatment. Marcus spent the next hour with Maria, telling her about his own journey from homelessness to meaningful employment. He explained the veteran services that had made his recovery possible and provided her with contact information for Amanda Foster and Dr. Walsh's transition program. "I never thought I deserved help," Maria admitted. "I felt like I had failed somehow, like asking for assistance would be admitting weakness." "That's exactly what I thought," Marcus replied. "But needing help isn't weakness, it's human. And accepting help when it's offered isn't giving up. It's being smart enough to take advantage of opportunities to improve your situation." As his shift ended, Marcus realized that his role at the hospital extended beyond just emergency medical response. He had become an advocate for veteran patients, someone who could recognize signs of service-related struggles and connect his fellow veterans with resources that could change their lives. The drive home to his apartment took him through the downtown area where he had once parked his SUV, searching for safe places to sleep. The contrast between his past and present circumstances never failed to amaze him. 6 months ago, he had been invisible, forgotten, and slowly dying. Now he was a valued member of a medical team, making a difference in people's lives every single day. His apartment was modest but comfortable, with furniture provided through various assistance programs and personal items that reflected his growing stability. Photos from his military service hung on the walls alongside his new EMT certification, and a thank you card from Carlos Mendez, who had made a full recovery from his construction accident. Marcus's relationship with Dr. Martinez had evolved into a deep professional friendship built on mutual respect and shared commitment to serving others. She had given him far more than medical treatment during his darkest hour. She had restored his dignity, his purpose, and his hope for the future. The hospital had also undergone significant changes following the investigation into Marcus's initial treatment. New training protocols ensured that all staff understood the importance of treating every patient with respect and dignity, regardless of their appearance or circumstances. The story of the homeless veteran who nearly died due to prejudice and neglect had become a powerful teaching tool, reminding healthcare workers of their fundamental obligation to serve all patients equally. Patricia Williams had been terminated following the investigation, but the incident had led to broader systemic improvements that would protect future patients from similar discrimination. Marcus took no satisfaction in her dismissal, but he understood that accountability was necessary to prevent other vulnerable people from suffering as he had. As he prepared for bed, Marcus reflected on the unexpected path his life had taken. The heart attack that had nearly killed him had instead become the catalyst for his resurrection. Dr. Martinez's recognition of his combat. Medic Tattoo had been the beginning of a chain of events that had restored not just his health, but his identity and purpose. Tomorrow would bring new challenges, new emergencies, and new opportunities to use his skills in service of others. Marcus Thompson, decorated combat veteran and emergency medical technician, was exactly where he belonged, saving lives and making a difference in his community. One patient at a time, the transformation was complete, but the real work of rebuilding and serving was just beginning. And for the first time in years, Marcus faced that future with confidence, purpose, and the knowledge that he was valued for exactly who he was: a healer, a veteran, and a man whose life had immeasurable worth. Up next, you've got 2 more standout stories right on your screen. If this one hits the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.